Hey everyone, and welcome. So you've probably gotten pretty good at using AI for the simple stuff, right? Basic notes, maybe a patient email. But let's be honest, what happens when a truly complex case walks through the door? I'm not talking about a simple cleaning summary. I'm talking about planning a full mouth reconstruction. It's time to go beyond single commands. Let's dive into some advanced AI workflows that can handle the real, messy, multi-layered challenges you actually face every day.
I mean, think about it. You get a new patient, they have poorly controlled diabetes, a history of osteoporosis, they're on bisphosphonates and blood thinners. And of course, they need multiple extractions and immediate implants. All of a sudden, that simple AI prompt you use for treatment plans feels, well, completely useless, right? This is where learning advanced AI goes from being a cool tech toy to an absolute clinical necessity.
So here's our game plan. We're going to start by moving beyond the basics. Then we'll tackle those super complex, multi-system patients. After that, we'll get into coordinating team care, mastering some tricky scenarios, and finally, we'll talk about how to think of AI as your new co-pilot.
All right, first up, let's get beyond the basics. This is all about a mindset shift. From just giving the AI simple commands to providing real strategic direction, you're basically teaching it to think more like a dentist.
You've probably felt this. You type in a prompt like treatment plan for tooth number 14, and you just know it's not going to cut it. It can't possibly capture the patient's bruxism, their periostatus, their high aesthetic demands, all of it. You've hit the ceiling of basic AI. The good news? There's another level. We're talking multi-step workflows built for the kind of complexity that defines modern dentistry.
Okay, Section 2, the multi-system patient. Here's where we're going to learn how to tame that overwhelming complexity with a really cool technique called prompt chaining.
Let's circle back to that patient we talked about, the one with diabetes, bisphosphonate history, and blood thinners. Their medical history is a mile long. The cognitive load just trying to process all that is immense. I mean, where do you even begin to figure out the right sequence of treatment, let alone make it safe?
So here's the strategy, a two-step prompt chain. It is beautifully simple. First, you get the AI to act like a triage nurse. You dump in all the raw data and tell it to organize and prioritize a problem list based on what's most important clinically. Then, and this is the chaining part, you take that clean, organized list and feed it into a second prompt to build the actual integrated treatment plan.
So here's what that first prompt looks like. You give it context, all the patient's data, you give it a role, act as a dentist, you give it a specific action, create a prioritized list, starting with the biggest safety risks, like managing the blood thinners, and you tell it the format. You're not just asking a question, you are literally teaching the AI how to think through the case, step by step.
Now for step 2. The context for this prompt is the perfectly organized problem list you just got from step 1. You see how they link together? You again give it a role and an action, but this time you ask for the really specific stuff. Medication precautions, healing timelines, you name it. And the result? You go from total chaos to an actionable, clear plan in minutes.
All right, on to Section 3, coordinating team care. This is huge. It's all about breaking down those communication walls between you, the oral surgeon, the orthodontist, the lab, you know the drill. It's about getting everyone on the same page with a shared mission.
And this slide says it all. Before AI, it's so easy for everyone to have their own siloed goals. You're focused on the final restoration. The surgeon is focused on implant placement. The ortho is just trying to move teeth. It can get messy and confusing. But with an AI-driven integrated plan, everyone is working toward one single shared goal, with everyone's role clearly defined. So much better.
And this really is the guiding principle. The patient's primary goal, let's say, I just want to be able to chew a steak again, that becomes the North Star for the entire team. When you center everything on what the patient actually wants, all the clinical steps just naturally fall into place. It's the perfect anchor.
And here's the prompt that makes it all happen. You feed it the context, your findings, the CBCT from the surgeon, the ortho workup, and crucially, that North Star patient goal. Then you give the AI the role of a treatment coordinator and tell it to create one single, cohesive strategy that puts every step of care in the right order.
Okay, let's shift gears and master some of those really tricky scenarios. You know, the situations that don't fit into a nice, neat box, like telehealth documentation and other weird edge cases.
So, telehealth. This is a question that probably keeps a lot of us up at night. How do you actually prove your value to an insurance auditor? How do you justify a treatment plan when you can't do a pulp test or even take an X-ray? It's a massive challenge.
The solution is to use AI to generate a perfect note that follows a really defensible checklist. You have to be super explicit. State that it's telehealth. Describe your visual assessment methods, acknowledge what you can't do, and, most importantly, document the skilled care you provided, the specific advice and education that proves why the consultation was necessary.
Now, for a real headache of a case, your patient has a shoulder injury from a workers' comp claim and a low back injury from a car accident. You're treating both in the same visit, but they have to be billed and documented completely separately to two different payers. This is a compliance nightmare just waiting to happen. Well, with a smart prompt, you can feed the AI all the data from the session and tell it to create two totally distinct notes. For the first one, you tell it to only pull out and document the details related to the workers' comp shoulder injury. Every intervention, every minute of time is firewalled to that specific claim. And then you run a second prompt using the exact same source data, but this time you tell it to create a note dedicated only to the personal injury low back claim. By creating this perfectly clean separation, the AI helps you maintain bulletproof billing compliance. This is an incredibly powerful tool for managing risk.
Okay, this brings us to our final section, your new AI Copilot. This is all about changing the way you think about these tools and really integrating them into your practice workflow. So let's just do a quick recap. For complex patients, use prompt chaining. For team care, use that North Star patient goal. For telehealth and billing headaches, use creative specific prompts. And always, always remember, this is decision support. The AI organizes, you are the one who commands. And why does this matter so much? Well, look at this chart. Manually documenting that complex dental case we talked about, that could easily take 45 minutes. A basic AI might get you down to 20, but with these advanced workflows, we're talking about 5 minutes. This isn't just a small improvement, it's a complete transformation of your admin time.
So this is how I want you to think about AI from now on. It's not an autopilot, it's a clinical co-pilot. Its job is to organize information, structure your documentation, and support your clinical reasoning. It frees you up to do the one thing it can never do: apply your expert judgment and actually connect with your patient. You are always, always the expert in command.
So there you have it. You've now moved way beyond simple commands to using sophisticated workflows. You've turned your AI from a basic scribe into a true clinical co-pilot. The only question left is, what other parts of your practice could use a smarter co-pilot? We'll dig into that next time. Thanks for watching.